Hello, nice to meet you all. So it's World Acupuncture Day, so I thought I'd start off and tell you a little true story. So in 1971, a famous journalist called James Reaston, he was from America, he went to China, this is him, on a business trip, and unfortunately, while he was there, he had to have his appendix out. So what then happened after his surgery, I'll pass this around in case you want to have a look at him. He had acupuncture for post-operative pain and also for his abdominal distension, and it was very successful. He then went back to America, told all the positive story, and then later on, President Nixon went over to China and he watched open heart surgery being done by acupuncture and sedation, but without any anaesthetic. And that was really what put acupuncture on the map and opened the doors of interest in America in the 70s. So I thought I'd show you that little story. So in Treat, in Norwich, we've got a mission statement. So I'd like you just to have a little read of our mission statement here. Whoops. So we're going to bridge the gap between Treat's acupuncturists and local GPs in Norfolk to reduce suffering of health conditions. So today I'm going to talk to you about acupuncture and how I believe we can take the strain off the NHS and what we're going to do about that in Norfolk, what my plans are. So at Treat we have 5 acupuncturists and we work privately within a private setting and our community multi-bed. We've got 6 beds in our community clinic. It's ever such a popular service, and I believe that making it more affordable is the key really at the moment, and if we can get it on the NHS, that will help so many more people. So by doing the multi-bed, it's a real insight really, because it's really, really busy. So and it's £24 a treatment as opposed to private treatment, which is £45. So I'd like to show you, so what I did then is I did an audit from my clinic. So I'll show you the audit results. So what I wanted to see was what exactly are we treating in our acupuncture clinic in Norfolk. So what did I find out? I wasn't surprised that musculoskeletal came out as the #1 condition, because we already have heard today about the evidence base for acupuncture for musculoskeletal conditions. So that wasn't a surprise to me. I specialise in fertility. I heavily promote my clinic in fertility. So I wasn't surprised to see that a large section of my patients come for fertility. But what did surprise me was the amount of chronic conditions that we're actually treating. And we get patients come to us with IBS, rhinitis, insomnia, chronic fatigue. The list is endless. And these patients tell me how they get better and how acupuncture is really effective for them and changing their lifestyles and making their day-to-day life more manageable. This week I was talking to one of my patients who's a Parkinson's patient, and I said to her, can I just ask you, what exactly are you getting out of acupuncture? And she said to me, it keeps me going. It helps my tremors and it uplifts me when I'm down. Now what the really lovely part about me treating her is when she first came to see me, she was suicidal. So she's had a massive change for her and her family. So with treating the chronic conditions, I believe this is an area within the NHS that we can really help, because we know that the age of patients, is getting more and more. The average age is increasing. We know that the NHS is struggling with chronic conditions. So I did a little bit of research into what happens with chronic conditions on the NHS. And I found out this is taken from my local CCG. So we found out that 50% of all GP appointments are made up of chronic conditions. 64% of all hospital outpatient appointments, quite a large number, isn't it? And 70% of all hospital bed days are chronic condition patients. and 70% of health money is spent. So surely, if I'm seeing it in my clinic and I'm seeing my patients really get better, isn't this an area that acupuncturists can really help to take the strain off the NHS? So what am I going to do? What are we doing in Norfolk to help communicate with the local GPs and the NHS locally? So recently we had a meeting with Clive Lewis, one of our local Labour MPs, and he's going to connect us to our local CCG. So we're waiting for that to happen. I've set up already a specialist group with the Federation of Small Businesses, which is going to help me and have some real good strategy into making this happen. So I'm due for a meeting with him next week, so I'll report back to the British Acupuncture Council about that. And then we're developing a package full of evidence-based acupuncture, and we're going to deliver this package to every single GP within the whole of Norfolk to get this message across that we can really help and take the strain off. And don't forget, like Rob already mentioned, we are a member of the Professional Services Authority, and that message is going to be firmly across in my package, because what that means is GPs can actually refer to us. And I don't think a lot of them actually know that they can do that. We're also going to be connecting with our local GP Federation. That's 22 GP surgeries, which will be getting together to provide other high-quality patient-focused services. So we're having a communication with them too, and this is all done through Clive Lewis, so he's helping us communicate and set up the connections there. So I'm grateful for his help. So I hope you can now see, after today, that the evidence is getting stronger. Treatment is effective. I see it every day in my clinic. I see patients get better. Let's help reduce the suffering and take the strain off the NHS, and let's bridge the gap.